problem for people that have insomnia, and we now understand it better and we can treat it better.
Very interesting. Another big problem, you define this, ADD and ADHD.
Okay, before we really touch on ADD and ADHD, because we're now understanding that by not getting proper sleep, then it can result in dysfunction during the day. But let's back up a little bit. We talked about obstructive sleep apnea. We talked about complete blockage of the airway, okay? Put that in this end of the spectrum. Put normal breathing over here and realize that there's a lot of things in between.
Right.
There are situations where individuals are going to have a narrower airway. They're going to be working harder to breathe. Just by working harder to breathe, that can disrupt their sleep. Their oxygen level may be fine. They're not stopping breathing, but they're working harder to breathe. And that causes brief disruption. We call those an effort arousal. Okay? There are individuals that will have this occur repetitively throughout the night and result in problems during the day, such as daytime sleepiness and fatigue or difficulty with concentration. Okay, but it's not sleep apnea per se. It's part of the spectrum. It's a milder form of this breathing problem. And it frequently goes under the radar screen by routine sleep studies. So routine sleep tests may not identify these real subtle breathing problems. We now know that children that are not going to get proper sleep at night may not function well during the day, and they're going to exhibit hyperactive behaviors and difficulty with their concentration. And the difficulty that the child may be having at night may be due to obstructive breathing. And sometimes the breathing problem could be as subtle as this upper airway resistance syndrome. So the child doesn't stop breathing, but they're working harder to breathe. So when you look at your child, you notice that they're having some labored breathing. Maybe they snore, maybe they don't. But they're having disrupted sleep, and that can result in their difficulty with their behaviors during the day. Another common problem for this would be restless leg syndrome. Children having this uncomfortable sensation in their legs, kicking in their sleep. So those are two common causes for ADD and ADHD. We now know that if we treat these children, then they don't need to have the stimulants during the day because they're getting better sleep at night and they're more focused during the day.
With us now is Jessica Darfour and her mother, Anna Jett. Jessica is a 6-year-old girl with ADHD symptoms. She was having difficulties in school, and Dr. Simmons diagnosed her with upper airway resistance syndrome, and he had her treated with CPAP. Now, Anna Jett described the kind of problems Jessica was having before she was treated.
She was not sleeping through the night. She was snoring, wheezing, bouncing off the wall, and having trouble in school.
After going through the sleep study, Jessica was treated with a CPAP machine, which she wears at night. Now, Anna Jett, tell me, what kind of a difference this has made?
She's able to sit still. She sleeps through the night. She can actually sit in the car without bouncing off the wall. She can actually sit in my lap with not moving, but she's actually nervous, so. But she's done a lot better. And now in school, she gets green all the time. She's much better. And the teachers have noticed a big change in her.
Jessica, do me a favor. Show me how you use the CPAP machine. You know, it's really impressive to see a 6-year-old child like that utilize a treatment device like the CPAP so easily and so effectively. You know, one of the really big questions is how you determine all of this. How a doctor like you discovers what problem really is preventing people from getting a sufficient and a good night's rest. That's where the testing comes in. And we're going to come back and talk about that in just a moment.
Does the dream of waking up feeling rested and full of energy elude you? If you or someone you know has difficulty getting proper rest from sleep, then turn to the Sadler Clinic Sleep Disorders Center, located in the Woodlands and Conroe, or Comprehensive Sleep Medicine Associates, with locations in Houston and Sugar Land. Director Dr. Jerald H. Simmons, a highly trained neurologist and sleep disorder specialist, and his staff can help make your dreams of getting a restful night's sleep a reality.
We're continuing now with Dr. Jerald Simmons. He is a Houston physician. As we pointed out before, he is a triple board-certified neurologist, which is very important, by the way, and I hope people understand that. And he is a specialist in sleep disorders. I understand you're doing a study right now that is looking into teeth grinding as one of the main things. You're learning why people do that? Correct.
Well, what we found is that, and for years I've been monitoring the symptoms of individuals with sleep apnea, and what we now realize is that 25% of patients that have obstructive sleep apnea actually grind or clench their teeth during their sleep. Okay, and what's more interesting is when we treat them with CPAP, more than half of them have improvement or complete resolution of the grinding and clenching problem. So now what we're coming to realize is that when people are asleep, when they start having obstructive breathing, one of the things that the brain tries to do is to help breathing out. So it tries to bring your jaw forward and your tongue forward. So the grinding and clenching is actually an attempt to protect the airway. So that's what we're finding is this relationship.
Is the CPAP the only way to treat that?
No, there's other ways of treating it. CPAP is the most reliable and most effective, and especially when someone has a lot of pain in their temporal mandibular joints when they first present with this problem, CPAP is really the only thing we really implement. But there are other ways of treating this, such as dental appliances.
Well, leave them right there. The camera can get a good shot of them.
Well, here, let me show you. This is right here. You have an appliance like this that goes onto the upper teeth, and then another part that goes in the lower teeth. And then there's a hook here. So basically this prevents the jaw from going back. This is a treatment that can be used for patients with sleep apnea, okay? And it can also be used for people that just snore.
Here's another instance where we have a patient who is suffering from what Dr. Simmons just talked about. Her name is Karen Brady. Karen had several problems with her sleep consisting of snoring and restless leg syndrome, but she also had bruxism. And that is grinding and clenching of her teeth during sleep and experiencing jaw pain and headaches. So Karen, tell us about the problems you were having before you were evaluated by Dr. Simmons.
Well, I was not sleeping very well. I had experienced TMJ. I was grinding at night. I was completely miserable, exhausted, and it seemed that it didn't matter which doctor I went to, nobody could figure out why this continued, even though I had tried other drugs and possibly other snore appliances. My issues still didn't go away.
Karen, tell me what happened after you were examined by Dr. Simmons.
I had a sleep study done, and during the sleep study they determined that I had sleep apnea as well as restless leg, and the combination of the two was not allowing me to get a proper amount of sleep at night. So from that, I went on to medication for the restless leg, and then I also used the CPAP. I was given a CPAP machine to try, and that was very successful.
I understand you're no longer using the CPAP machine. Now, how are you being treated now?
I have moved from the CPAP machine to a tap appliance, which I brought with me. I had this tap appliance made for that is able to go over my teeth, and then from that it holds my jaw in place so that the TMJ is no longer flared up at night, and I am not grinding, and I'm not snoring, and I'm resting, and I'm comfortable, and I have no pain, no headaches or anything, and I'm off the machine.
You know, it's really good to see you doing so much better. Some of the other problems before we get to the testing: heartburn in the morning, or headaches in the morning rather than heartburn.
Right.
A problem from sleep.
Big problems. A lot of people will go to multiple doctors because they have headaches, and they're waking up with their headaches. If a person wakes up from their headaches, the first question you have to ask is, what's occurring during the sleeping process that's triggering the headache?
Right.
And frequently it's obstructive sleep apnea, or it may be the upper airway resistance syndrome.
And people go through this and they don't have a clue it's caused by improper sleep. They just don't know. Heartburn, bedwetting. Bedwetting caused by improper sleep?
Well, obstructive breathing can actually cause bedwetting, especially in kids. But also there are some kids that will actually have seizures in their sleep, and that could be causing the bedwetting. So when we do a sleep study in some in children, if bedwetting is the problem, we'll do a full epilepsy study in the child during their sleep to see if they're actually having seizures.
One other thing I have heard, to explain to me if I'm right, people who have excess weight have more sleep problems, that if you can lose weight, it might help cure those problems. Is that right?
Yeah, weight is a big problem for people that have obstructive sleep apnea. But it's not just weight. That's important, because if you think that this is a problem only with obesity, that's incorrect. Thin people can have obstructive sleep apnea due to the structure of the airway. A small jaw, an overbite, recessed chin, a high-arched palate. Chronic fatigue syndrome. There are women that don't even snore, but they're working harder to breathe. They're frequently nasally congested. So what you're saying is true. And what's also true is that sleep apnea causes an increased risk of heart disease, high blood pressure, stroke, heart attack. So what's occurring during the night is affecting our health overall. And most of our testing that we do on patients is during the day, so we miss the whole process. But I just don't want you to think it's only a problem of obesity.
Next, we come to Mary Margaret Brierley. Mary Margaret is a physically fit, very well-educated mother who barely snored and certainly did not fit the stereotypical profile of a patient with obstructive sleep apnea. Mary, question. Were people surprised when you were diagnosed with obstructive sleep apnea?
Yes, other people were very surprised that I had sleep apnea and actually get kind of a big laugh about me having it. I get a lot of teasing about my CPAP machine from my friends, but you know, it's just changed my life so much. I'm happy to tell people about what has happened to me.
You know, I would imagine that many people who have similar problems could certainly benefit from this kind of